Hello, and welcome to the VA Palo Alto Healthcare System. One of our missions is to provide veterans and active duty service members experiencing vision loss with the best care and rehabilitation possible. We want to make the care accessible and tailored to the individual's needs. We've been able to accomplish this through the cooperative and collaborative efforts of our professionals who provide services from very basic vision care to state-of-the-art medical care and comprehensive low vision and blind rehabilitation services. We frequently have veterans tell us that they never knew the VA offered such services to those with vision loss. Our continuum of care approach ensures that whether your need is for a routine eye exam, eye surgery, or vision rehabilitation, the Palo Alto Healthcare System will provide you with world-class vision care designed to your needs. Join us as we take a look around.
The goal of the optometry clinic is to provide the best vision possible for each patient. This, for most patients, will involve an eye examination every 1 to 2 years, and the doctor will look both at the optical correction or the glasses to maximize their sight, as well as evaluating the health of the eyes to rule out any conditions that might cause permanent loss of sight. If a patient has an eye disease or an injury that causes permanent loss of vision and medical treatment has stabilized that condition, then the optometrist will provide a low vision examination. This is an exam where we use glasses and telescopes, electronic and optical magnification to maximize the remaining sight. If a patient requires more vision rehabilitation than can be provided in the optometry clinic, such as orientation and mobility or adaptive techniques to live in their home, then the patient will be referred to the G-Victors program, which is an outpatient, home-based rehabilitation program, or the Western Blind Rehabilitation Center, which is an inpatient residential rehabilitation program. Brain injury, whether acquired or traumatic, can cause a lot of different dysfunction with the eyes. The optometrist does a specialized examination that's specific to brain injury, and then the patient will be referred for either binocular vision training or to the comprehensive neurovision rehabilitation program if there's vision loss or field loss accompanying that traumatic brain injury.
Ophthalmology department here at VA Palo Alto is a full-service division. We're very fortunate that we have an in-house faculty which includes a subspecialist of glaucoma surgery, retina vitreous surgery, cornea surgery including transplantation, cataract surgery, oculoplastics. We work very closely with optometry in the sense of working with low vision, contact lenses, refraction. They help us with our pre- and post-surgical patients. And as far as the blind center, we often interact with them because many of their patients require ongoing care that we deliver here in our clinic, particularly in the retina vitreous service with macular degeneration. We have one of the 4 centers in the VA here, 4 polytrauma centers, and as such we interact very closely with them along with the other vision care services here. Polytrauma is a designation by the VA which covers veterans who've been injured in multiple organ systems. Blast injury that causes the brain injury can certainly damage the visual system even though the patient may not be aware of it. So we're very thorough in our examinations.
As the Visual Impairment Services Team Coordinator, I'm the primary case manager for blind and visually impaired veterans, caregivers, and families, as well as providers in need of information about the blind rehabilitation service, benefits, and training that we offer. We have a plethora of different opportunities for veterans, depends on, again, what they need, what they want. We also offer a medical review as part of the process where veterans can receive an audiology exam, an EKG, chest x-ray, blood work, a visit with their primary care doctor, and an optometry exam. It's important for us to get the word out because many veterans don't realize that they're entitled to these benefits, especially for their eyes. Folks believe that if they're not entitled to benefits unless they've lost their sight in the service, and that's simply not true. Benefits are available for any type of vision loss. It simply depends on whether the veteran first wants these benefits, wants to receive this therapy, and second, how best can we provide the therapy for the veterans.
A lot of times when people experience vision loss, they'll get connected to a program like ours and have it addressed at the beginning of a decrease in their vision. The main theme of the G-Victors program is that we provide individual outpatient rehabilitation in an individual's home. Any kind of tasks that are challenging due to any level of vision loss, whether it be reading, writing, working in the kitchen, they need to be independent and working within their environment. So we make sure, as an outpatient rehab service, that they get a full transitional program that is effective out in their home and in their community. The blind rehabilitation outpatient specialists really help G-Victors out with their caseload, and they also have a really unique role here at Palo Alto working with polytrauma.
BROS has a close relationship with optometry and is integrated with the polytrauma team. They provide co-treatment with occupational therapy, physical therapy, speech-language therapy, and other therapies. BROS provides people with vision loss training to help them achieve greater independence in their lives.
Coming to the Blind Center, the most important thing they're learning is new strategies to deal with the vision loss. In the continuum of care, the Blind Center offers the highest level of comprehensive care. Various skill areas include visual skills, orientation and mobility, living skills, and manual skills in the regular program. The Computer Access Department works with adaptive software, whether it's Zoom Text, which is large print, or screen reader software to help students learn to use the computer. The specialty programs that we have are the GPS training, where they learn to use GPS to navigate in the community. The Power Mobility program is learning to use a scooter or a power wheelchair. And then we have our CNVR program, which is new.
The CNVR program was created at the Blind Center to address the needs of patients with neurological vision loss. The big part is the NVT Vision Rehabilitation System, which is a light panel used to assess and train individuals with visual field deficits, visual spatial neglect, and visual processing disorders. An important CNVR program focus is patient and family education and management of visual impairment, as well as any associated cognitive deficits.
Looking at the training, not only does it include the specific skills, visual skills, mobility, it's also the nursing care, the recreation activities, so it's more looking at the whole person. I think that's one of the great things about coming to the Blind Center, is that you get a whole package.
Thank you for being with us today and touring the VA Palo Alto healthcare system. We hope this visit has helped you understand how our continuum of care allows us to offer you the best and most comprehensive vision care available anywhere. Please call or visit our website for more information. Call our Visual Impairment Service Team Coordinator at 650-852-3467 or visit our website at www.palo-alto.med.va.gov/WBRC.